My name is Dr. Shawana and I'm a board certified women's health nurse practitioner, and I have the honor and privilege to present on a very critical and important topic, sexually transmitted infections in women. And I'll give some important data around current statistics occurring in the state of Georgia, and I'll focus on specific infections. So I don't have anything to disclose or any conflicts of interest in relationship to this presentation. So the learning outcomes are as follow for this presentation. You'll be able to understand common types of sexually transmitted infections that affect women. You'll be able to identify potential risks associated with untreated sexually transmitted infections in women. And last but not least, you'll be able to explore some resources that are available for STI testing, treatment, and prevention tailored specifically to the needs of women as well as their concerns. So what are sexually transmitted infections? So sexually transmitted infections are infections that are spread through sexual activity that may include vaginal, anal, and oral sex. So looking at some data specifically within the state of Georgia, based on data from the Georgia Department of Public Health, in 2020, there were over 55,000 reported cases of chlamydia among women in the state. In regards to gonorrhea in 2020, there were over 16,000 cases of gonorrhea among women. In regards to syphilis, in 2020, there were over 600 reported cases of primary and secondary syphilis among women. And with HIV, based on data in 2020, there were over 13,000 women living within the state of Georgia with HIV. And this is data from the CDC as well. So there are various types of sexually transmitted infections. They may include bacterial, viral, as well as parasitic. So some infections that we'll explore today will be chlamydia, gonorrhea, genital herpes. We'll also discuss vaginitis, which is very common among individuals or women, I should say, and individuals that have vaginas. Vaginitis includes bacterial vaginosis, trichomoniasis, which is the only one of the three that is a sexually transmitted infection, as well as vulvovaginal candidinitis, which is also known as a yeast infection. So when it comes to chlamydia, chlamydia tends to be asymptomatic infection in women, meaning that women present with no symptoms at all. If women do have symptoms, they may include what we call postcoital bleeding or bleeding after sex, dysuria, or that's burning during urination, as well as vaginal discharge. But remember, most women are asymptomatic, meaning that they don't present with any symptoms at all. So what causes chlamydia? So the specific bacteria that causes chlamydia is called Chlamydia trachomatis. It's most prevalent in women or individuals, not just women, individuals that are 24 years of age or younger. And based on CDC guidelines, annual recommendations for screening are for individuals who are sexually active, 25 years age or younger. And then targeted screening is recommended for those who are 25 years or older based on their specific risk factors. So what are consequences or long-term impact of a chlamydia infection that may be left untreated for some time? That can lead to something called pelvic inflammatory disease or PID, which PID can lead to infertility. Also, chlamydia being left untreated can also lead to something called ectopic pregnancy, meaning a pregnancy that is outside of its normal location, which is in the uterus. So it can be in a fallopian tube, was the most common place. So what is recommended treatment? So based on the current CDC guidelines, an antibiotic called doxycycline is recommended to treat and cure chlamydia infections. Please note that this is just one treatment regimen. There are alternative treatment regimens, and those will be other antibiotics that an individual can discuss with their healthcare provider if needed. So moving on to the next sexually transmitted infection, so gonorrhea. So most women or individuals that have a vagina are asymptomatic, meaning that they don't have symptoms at all. But if they do present with symptoms, again, the most common symptoms that may be present are postcoital bleeding, that is bleeding after intercourse, dysuria, which is pain or burning during urination, as well as vaginal discharge. Some signs that maybe a healthcare provider can see on exam, if an individual has a cervix, they may see some purulent discharge at the cervix. If it's a male, they may have penile discharge. A female or individual with a cervix, on exam, their cervix could bleed very easily. So again, gonorrhea is a bacterial infection. It is caused by a gram-negative Diplococcus bacteria. Sites of infection could include the endocervix, urethra. It can also be in the throat, and it can also be in the anus. And it, again, recommendations based on the CDC guidelines for women or individuals with vaginas. Those who are less than 25, yearly screening is recommended. Those who are 25 or older, targeted screening based on their specific risk factors will be considered for screening. So what are potential long-term effects of gonorrhea being left untreated? Like chlamydia, it can lead to things like pelvic inflammatory disease or PID, infertility, or ectopic pregnancy. It also can cause septic, arthritis, as well as bacteria, meaning that bacteria is in your blood. It can cause infections of specific glands that are located near your individual's vaginal area. And if an individual is pregnant, it can cause pregnancy complications. So recommended treatment, again, based on the current CDC guidelines, is an antibiotic by the name of, we call it cefotriaxone, 500 milligrams given in a single injection in the muscle. So moving on to the next sexually transmitted infection called genital herpes or HSV. So when an individual presents with a new or what we call a primary infection, again, they may not have any symptoms at all. However, they could present with system-wide symptoms, which may include a fever. They may be very tired or fatigued or malaise. They could have a headache. If symptoms are present on their genital areas, they may have, or you may, on exam, a provider can see multiple small, very painful ulcers. It's important to note that there are two types of genital herpes, or two types of herpes virus. One is called type 1, one is called type 2. So herpes simplex 1 is commonly found in the mouth area. Herpes simplex 2 is commonly caused or found in the genital area. Also important to know that HSV1 can be noted on the genital areas. The most common times that can occur is if a person has a partner who may have what we call cold sores, and if they perform oral sex on that individual, that's a way to transmit type 1, HSV1, to the genital area. So HSV1 can be present on the genital areas as well. So recommended treatment for the first clinical episode, meaning the first time a patient presents, one of the recommended treatments is a cyclovir, 400 milligrams orally 3 times a day for 7 to 10 days. And again, this is just one. There are multiple other medications that can be used as well. So if an individual has typically 10 or more outbreaks throughout a year, they may want to consider what we call suppressive therapy, meaning medication that they take every day to prevent an outbreak from actually occurring. And again, one treatment for that is called a medication called acyclovir, which is taken every day and it's taken twice a day. And this is one of the recommendations for medication. There are other choices as well. So another way a patient can undergo treatment is what we call episodic for recurrence. So meaning the patient or person only receives treatment when they actually experience an outbreak. And one of the medications that can be used is again acyclovir, and it can be taken in 2 different ways. So moving on to vaginal infections. So vaginal infections, of the 3, one is only considered a sexually transmitted infection, and that's trichomoniasis. Bacterial vaginosis is the most common, followed by vulvovaginitis, candidinitis, which is considered a yeast infection. That's the second most common. So we'll take a deeper look at these 3 types of vaginal infections. So for bacterial vaginosis, often patients may not have any symptoms at all. However, when they do present with symptoms, the most common one they'll say is they notice a fishy odor, especially after they have intercourse. They also may describe a discharge as very thin, whitish gray as well. And this picture here shows what a healthcare provider will see under the microscope when they collect the vaginal swab. These are called clue cells, which are a form of the cells that help us diagnose what bacterial vaginosis is. So bacterial vaginosis is defined as the ulceration of normal flora in the vagina with overgrowth of anaerobic bacteria. So usually when I see patients, I tell patients, well, it's bacteria that's normally found in the vaginal canal, but it's the not so good bacteria, which is usually in a small amount. What happens is there's an overgrowth of it and it causes bacterial vaginosis. But again, this is not sexually transmitted. Some things that can contribute to women or individuals with vaginas having bacterial vaginosis are if women douche, so we do recommend not douching. Using like body washes that have like high fragrances in there can also cause a shift in the vaginal flora and lead to bacterial vaginosis. Other things that can contribute to it is if you take baths, but you use like a lot of bubble baths that has fragrances that can cause a shift in the vaginal flora. Using panty liners that have like a scent to it, or pads or tampons that has a scent to it, and your vaginal fluids are exposed to it. Again, that can cause the not so good bacteria that normally lives in the vaginal canal to overgrow and cause a shift in the vaginal flora that leads to bacterial vaginosis. So we really try to counsel women and individuals with vaginas to really try to avoid products like that. But the number one thing is really avoid douching, because that really can lead to bacterial vaginosis. So recommended treatment based on the CDC current guidelines is a medication called metronidazole, and it's taken twice a day for 7 days. Sometimes patients don't prefer to take pills or can't tolerate the pills by mouth. There's a vaginal gel, metronidazole gel, that can be used for 5 nights at bedtime that also cures or treats bacterial vaginosis. So moving on to trichomoniasis. So trichomoniasis, again, this is a sexually transmitted infection. And again, for most people, they don't have symptoms, but if symptoms are present, you may have a vaginal discharge that may be a frothy greenish color. There may be vaginal or vulval irritation and itching, bleeding after intercourse, as well as burning during urination. So trichomoniasis is caused by a parasite. And under the microscope, as healthcare providers, we'll typically see the organism like this that helps us diagnose trichomoniasis. So current treatment recommendation, and again, this is just one of the medications that can be used to treat trichomoniasis. It's metronidazole, taken twice a day orally for 7 days for women or individuals with vaginas. So moving on to vulvovaginal candidiasis, also known as a yeast infection. So symptoms typically include irritation around the vulva or vagina. Patients may report a very thick white vaginal discharge, kind of like cottage cheese. Pain during sexual intercourse. There may be some inflammation around the vagina and vulval. And again, that thick cottage cheese-like discharge. So the yeast infections or vulval candidinitis is caused by a yeast organism. What are some common things that can cause it? Use of antibiotics. So sometimes patients, when they see their healthcare providers, they'll tell them like, well, usually if I take an antibiotic, I usually will have a yeast infection. And sometimes the healthcare provider may prescribe an oral medication to help treat the yeast infection or recommend over-the-counter medication to treat the infection. Or they could recommend some dietary things that patients can do to help prevent a yeast infection from occurring when taking an antibiotic. Pregnancy, because of the shift in hormones, sometimes that can lead to a yeast infection. Reproductive age, individuals or women within a reproductive age range typically may experience a yeast infection throughout their lifetime. A woman who maybe have diabetes that's not controlled, having uncontrolled blood sugars can lead to overgrowth of yeast and cause yeast infections. If an individual has an immunosuppressive disorder, that can cause it, as well as sometimes frequent intercourse can lead to yeast infection. But it's important to note it is not a sexually transmitted infection. So recommended treatment, and again, these are just a few of the recommended treatments. There are more treatments that are listed based on the CDC's guidelines, but for prescription-based, you have traconazole, which is a vaginal cream that is inserted in the vagina for 7 days. An oral medication, fluconazole, prescribed by a healthcare provider in a single dose, as well as over-the-counter intravaginal agents. One could be clometrazole that is inserted into the vagina for 7 to 14 days. And again, these are just a limited list. There are other options as well. So what are some local resources for women here in the Georgia area? So we have Planned Parenthood of the Southeast, again, that provides screening and testing for sexually transmitted infections, as well as a lot of educational resources. There's also the Georgia Department of Public Health. Again, the Department of Health provides information on STIs, as well as testing and treatment. We also have within the state of Georgia, specifically within the city of Atlanta, the Center for Black Women's Wellness. They also provide healthcare services, which include screening and testing for sexually transmitted infection, as well as treatment. Some national resources that are available to women. The CDC, or the Center for Disease Control and Prevention, provides a whole host of resources and educational materials related to sexually transmitted infections. We also have Planned Parenthood Federation of America, which provides a lot of information and education on sexually transmitted infections and ways to reduce the risk for exposure. Also, the American Sexual Health Association provides information and education about sexually transmitted infections. The Women's Health.gov, again, is a government-based website that provides up-to-date information on sexually transmitted infections. And we also have the American College of Obstetricians and Gynecologists that provides a nice pamphlet and resource for patients about sexually transmitted infections. So these are the list of references for this presentation. And this is my contact information. And that concludes my presentation.